I'm Kristie. I'm a communication technician and I'm living with overactive bladder. After a couple of weeks of having my first BOTOX OAB treatment, I noticed that I was having fewer leaks. Since starting on BOTOX, I've found that I don't need to use the bathroom as often, which is quite a relief. BOTOX has been an effective OAB treatment for me, and I wouldn't want to miss my next treatment appointment. Now, before I even leave the office after each treatment, the staff schedules me for the next appointment. At times, I may need to change my appointment because of a scheduling conflict, but once I'm on the schedule, I can always call and adjust it. Scheduling my next procedure before I leave the office helps me find a date and time that works best for me and my doctor. It's important to me knowing that I have the next one on the books. I really like that since I started on BOTOX, and because of my retreatment schedule, I am free from taking daily OAB pills that didn't work well enough for me. BOTOX has helped me cut down on how often I have to go to the bathroom and reduce the number of leaks I experience during the day. To me, that makes my treatment appointments well worth it. I am so glad I found a treatment that works for me. You may want to ask your doctor if BOTOX may be right for you too.
Indication: BOTOX, onabotulinum toxin A, is a prescription medicine that is injected into the bladder muscle and used to treat overactive bladder symptoms such as a strong need to urinate with leaking or wetting accidents, urge urinary incontinence, a strong need to urinate right away, urgency, and urinating often, frequency, in adults 18 years and older when another type of medication, anticholinergic, does not work well enough or cannot be taken. Important safety information. BOTOX may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks after injection of BOTOX. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms, including loss of strength and all-over muscle weakness, double vision, blurred vision, drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, and trouble swallowing. BOTOX may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of receiving BOTOX. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Do not receive BOTOX if you are allergic to any of the ingredients in BOTOX. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myoblock, Rimabotulinum toxin B, Dysport, Ababotulinum toxin A, Xeomin, Incabotulinum toxin A, Juvo, Probotulinum toxin A, XBFS, Daxify, Daxabotulinum toxin A, LANM, or Latibo, Letabotulinum toxin A, WLBG. This may not be a complete list of all botulinum toxin products. Have a skin infection at the planned injection site. Do not receive BOTOX for the treatment of urinary incontinence if you have a urinary tract infection, UTI, or cannot empty your bladder on your own and are not routinely catheterizing. Due to the risk of urinary retention, difficulty fully emptying the bladder, only patients who are willing and able to initiate catheterization post-treatment, if required, should be considered for treatment. Patients treated for overactive bladder. In clinical trials, 36 of the 552 patients had to self-catheterize for urinary retention following treatment with BOTOX, compared to 2 of the 542 treated with placebo. The median duration of post-injection catheterization for these patients treated with BOTOX 100 units, N equals 36, was 63 days, minimum 1 day to maximum 214 days, as compared to a median duration of 11 days, minimum 3 days to maximum 18 days, for patients receiving placebo, N equals 2. Patients with diabetes mellitus treated with BOTOX were more likely to develop urinary retention than non-diabetics. The dose of BOTOX is not the same as or comparable to another botulinum toxin product. Serious and/or immediate allergic reactions have been reported, including itching, rash, red itchy welts, wheezing, asthma symptoms, dizziness, or feeling faint. Get medical help right away if you experience symptoms. Further injection of BOTOX should be discontinued. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of BOTOX. Tell your doctor about all your medical conditions, including if you have or have had bleeding problems, have plans to have surgery, had surgery on your face, have weakness of forehead muscles, trouble raising your eyebrows, drooping eyelids, and any other abnormal facial change, have symptoms of a UTI and are being treated for urinary incontinence. Symptoms of a UTI may include pain or burning with urination, frequent urination, or fever, have problems emptying your bladder on your own, and are being treated for urinary incontinence, are pregnant or plan to become pregnant. It is not known if BOTOX can harm your unborn baby. Are breastfeeding or plan to. It is not known if BOTOX passes into breast milk. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Using BOTOX with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received BOTOX in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injection of botulinum toxins such as Myoblock, Dysport, Xeomin, Juvo, Daxxify, or Latibo in the past. This may not be a complete list of all botulinum toxin products. Tell your doctor exactly which product you received. Have recently received an antibiotic by injection. Take muscle relaxants. Take an allergy or cold medicine. Take a sleep medicine. Take aspirin-like products or blood thinners. Other side effects of BOTOX include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, eye problems such as double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids and dry eyes, drooping eyebrows, and upper respiratory tract infection. In adults being treated for urinary incontinence, other side effects include UTI and painful urination. In patients being treated for urinary incontinence, another side effect includes the inability to empty your bladder on your own. If you have difficulty fully emptying your bladder on your own after receiving BOTOX, you may need to use disposable self-catheters to empty your bladder up to a few times each day until your bladder is able to start emptying again. For more information, refer to the medication guide or talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including boxed warning and medication guide, or visit https://www.rxabv.com/pdf/BOTOX_PI.pdf. If you are having difficulty paying for your medicine, AbbVie may be able to help. Visit abbvie.com/patient access support to learn more.